The birth of a child can present you with a range of jumbled up emotions, ranging from happiness, joy, to nervousness, being anxious, being fearful. Did you know that even fathers can go through depression and PTSD after the birth of the child? Baby blues or depression is commonly associated with women. But today we are going to talk about something which is not discussed much, which is less talked about: PTSD in fathers. So stay tuned to know what it feels like to be a father who has PTSD. According to a research in Journal of Medical Association, 10% of men go through PTSD after the childbirth. It is very commonly associated with women, but studies show that even men undergo serious mood changes after the arrival of the baby. It can occur in any time in the first year of the childbirth. The symptoms of PTSD in men usually resemble the general depressive symptoms, wherein you have sadness of mood, you are irritable, you don't feel like communicating, you go into your shell, you have anxiety, you feel hopeless, helpless, or maybe worthless, you have negative thoughts, less sleep, decreased appetite, a varying range of emotions that you feel. But particularly in men or in fathers who are having PTSD, it can also increase risk of alcohol abuse, alcohol intake. It can lead to indecisiveness where you are confused, you're in conflicts, you don't know because you can't think straight. It can also lead to rage. Especially in men, depression is mainly reflected in your anger more than in your sadness. The emotions are more constricted. You will also have problems relating with your child, playing with him or her, being there for him or her, and that may also make you so super guilty. So let's see some of the causes and the risk factors for the fathers, new fathers, to develop PTSD. Number one is that after the birth of the child, there is hormonal changes. Like we talk about hormonal changes in women before and during the process of pregnancy, even men undergo hormonal changes. There is a drop in the testosterone level, estrogen levels are high, and it may cause them a lot of trouble and mood swings. Especially they are not getting, like the mothers, they may feel unable to sleep properly, have that intimacy with their partner. It can cause and lead to a lot of frustration because it's also new and a rapid change in somebody's life. Also, if you have had a history of depression earlier, this could act as a trigger that changes the activities that you have been doing throughout the day. There is an interruption in it because now there are new things that you have to do for your baby. A cutoff from that can also trigger your mental illness or depressive or anxious feelings. Third, if your partner is depressive, if your partner has depression, you can catch those feelings from them. In a way, if your partner is having depressive feelings or is in depression, it's a chance that you might also get depressive. The chances are higher, and you both are unable to cater to the baby. And especially some hormonal changes or anything like isolation. Maybe you had a habit of socializing, and suddenly because of the arrival of the baby, now your world is little limited for the time being. And especially for the men, expressing yourself, and you have been talking to your partner, expressing, but your partner is also busy with the baby, so you might feel that there's nobody you can open up to or talk to about your feelings. This can create some kind of depressive feelings or baby blues. Some other reason can be partner conflict. Maybe you have some ongoing fights with your partners, which creates a lot of stress, and after the baby has come, you might not even have the time to resolve it or talk about it. It can increase stress levels. Although the last factor, unintended pregnancy, if you were not prepared for this child, if all of this happened by accident, then you may not be able to relate completely or be wholeheartedly involved in it due to so many factors and constraints going on in your mind. It can also lead up to regret and guilt, which can again lead to depressive feelings. What to do about it? How to go about it? How to prevent it? First thing, build your network. Your social network should be strong. You should know whom to contact, whom to ask help. You should be in a position to be able to discuss your feelings with a professional or with friends, with family. Also, keep your budget and finance in check before the arrival of the baby so there are no uncertainties, no anxious feeling regarding the future, the security of the baby. Keep that in check, in plan. Also, talk to a mental health professional if you have any of these symptoms. It's completely normal. It's completely normal. You would take your wife to a therapist if she's feeling this. So even you can reach out online or offline and talk about it. Postpartum depression in fathers can really affect and impact your ability to relate with the kid, to go to your work, and it can increase suicidal thoughts. And we can all avoid it. So whenever you feel any of this, please reach out. Through CBT, cognitive behavior therapy, to interpersonal therapy, these issues can be addressed. Short and long-term antidepressants can also help you. Many people just benefit from talk therapy. So I think that's a motivation. Please go for it. Any queries you have, please leave in the comment section and let me know. Reach out in case of any concerns.